As you all know, the world has come to a standstill. Most of us, including our generation and our elder generations, are encountering this pandemic for the first time. Economy from across the globe is collapsing. Lockdown periods in most of the developing countries are being encountered. During this crucial phase, can we take the aid of ML for predicting the new cases and casualties? Well, it goes without saying that a person with a hammer would nail whatever that comes before him. The same is the case with AI and ML. ML can help expedite the drug development process, provide insight into the current antivirals, forecast infection rates, and help screen patients faster. Welcome to the session where I had consolidated the recent happenings about the COVID cases across the world, which would help understand the role of ML in handling the present crisis. COVID-19, the name given by WHO for this new virus, was officially announced by WHO as a pandemic in February 2020. This pandemic has started gripping the world in panic, capturing around 200 nations with a casualty of 37,000 deaths and affecting more than 7.5 lakh people across the world. In fact, its predecessors of corona or COVID-19 like SARS and MERS have also killed around 10% to 34% of the population. But why novel coronavirus or COVID-19 is scary? It is because of its exponential growth. Between one infected person in a population, it is able to infect the uninfected person with a ratio of 2.2. The transmission rate can be reduced only by social distancing. This is achieved through lockdown affecting economy. This GIF gives us a harsh reality which is affecting the entire world last 3 months. Started in China and rapidly spreading to other parts of the world. And starting with a couple of cases, the spread of COVID-19 becomes exponential within a span of week or two. Right now you can see the epicenter located in United States affecting 1.6 lakh people. Most of the world-related data can be obtained from www.worldometers.info and the present status as of March 31st, 2020, there are around 7,84,000 plus confirmed cases of COVID-19 across the globe with a whopping 37,000 deaths. Now let us see what are the methods to aid in the curtailment of COVID-19. In the present scenario, four areas where ML can be used are predicting the structure of proteins and their interactions with chemical components to facilitate new antiviral drugs and vaccines. This area has been covered by researchers all over the world. Next, forecasting the infection rates and spread patient prognosis to enable hospital and help health officials to better plan resourcing and response. Next is in helping in diagnosing of medical images like X-ray or CT scan. And last, to mine social media data to better estimate the spread and symptoms and general public perception about the estimate of spread of disease. Now let us start with the first application. ML aiding in predicting the protein structure. As of now, 3 research papers are available which are not peer reviewed. The first one, deep learning based drug screening for novel coronavirus 2019 nCoV, is applied to molecules, and CNN is used to model the molecules or molecular interaction. In this case, modified dense net with convolution is used to predict the protein legend interactions. RNA sequencing of COVID-19 is used to predict which drugs works the best in this case. In the second work, which is on predicting commercially viable antiviral drugs that may act on novel coronavirus, the author looks at the commercially available drugs and use a different modeling approach. Molecule transformation drug target network is used in this case. The protein structure is compared to the existing antiviral medication which is used in the treatment of HIV and AIDS. The third one, which is Deepmind, uses available data sets of computational chemistry to predict the protein structures of COVID-19 virus. AlphaFold, a deep learning library, is used in this case. Now let us see how ML is aiding in forecasting infection rates and patient prognosis to enable hospitals and health officials and to have a better planned resourcing and response. The prior work, which is shown in the first paper, prediction of criticality in patients with severe COVID-19 infection, has studied forecasting through seasonal flu and other outbreaks. In the finding an accurate early forecasting model, XGBoost model is used to predict if a patient infected with COVID-19 would survive the infection based on age and other risk factors. The data-based analysis, modeling and forecasting of COVID-19 outbreak works on a concept of CERT model, where CERT stands for susceptible, infected, recovered and dead model. And the column filter to predict spread of coronavirus uses time series prediction and is based on the current number of cases. What would be the count of cases on another particular day? So it was found the accuracy based on the column filters, the 1 day prediction was very accurate using this particular approach. ML aiding in diagnosis of medical images like X-ray and CT scan. Deep learning on imaging helps in this area and provides insights into the disease itself. Diagnosing coronavirus related pneumonia from CT scan can potentially shorten the time of diagnosis and enable better treatment. Also, from the different papers, it is obvious that deep learning is predominantly used along with medical imaging to facilitate doctors for quicker diagnosis of COVID-19. The previous two approaches has to be aided by a virologist or medical practitioner. But ML aiding in mining social media data to better estimate the spread of disease, an ML expert can play his role in analyzing the search engines and social networking sites to track trends of different diseases 7 to 10 days faster than what government agencies like Center of Disease Control and Prevention take to find out. In forecasting influenza levels using real-time social media streams, Google Flu uses online search queries to estimate the current influenza activity that predicts influenza activities and provide accurate real-time assessment and combines real-time data streams for accurate predictions. One way of looking at the spread of COVID-19 is by tracking. Advanced analytics talks about the different types of tracking. To start with, the spatial temporal analysis helps in modeling the spread through various spatial and temporal scales, and Bayesian inference methods facilitate the analysis through time and space. In path analysis, Sankey diagrams help to visualize the flow of patients between various phases of patient's journey. The degree of interconnections between the cases and infected clusters can be visualized through a network map. Each node in the infected person and the edge is the contagion through a contact. Through the personal electronic devices, PED, the location, both present, historical, mobility patterns, browsing patterns, buying patterns, friend circle can help tracing the mobility of a quarantined person. These details can aid in assessing the movement of a quarantined COVID patient, although it comes with a threat through the privacy. Now let us see how AI helps in fighting coronavirus outbreak. Deepmind is releasing structured predictions of several proteins to promote research. This helps in finding out a drug for COVID virus. Alibaba's AI can detect coronavirus in CT scans of patients' chest with 96% accuracy for pneumonia cases. Blue Dot uses online sources, airline flight information to make predictions. And Blue Dot was the first one to give a prediction in November 2019 that a pandemic is in future. Insilco uses AI for drug discovery through generative adversarial networks GAN to filter molecular design. In Insilio Medicine, AI-based software that can quickly highlight potential problem cases in record time is being devised. Since time facial recognition applies AI to scan faces of people with masks so that the person to material touch is avoided. Not only that, drones were used in Shengon to help medical staff and in multicopter to transport medical samples and conduct thermal imaging. UVD robots were used to disinfect patients' room with zero human intervention. With AI and ML, there will be a tremendous saving of time and lives in finding a cure for the novel COVID-19. The dashboard set up by Indian government is covid19india.org. With my set of 5 enthusiastic undergraduate computer engineering students, I was just able to work with the raw data of the COVID-19 India data set, and the students cleansed the raw data and they used logistic regression model to predict whether the new patient would get recovered or not. This was using only two parameters, age and status of the patient, whether it's diseased or recovered. But when the travel history was also taken into picture, that is age, status and travel history, logistic regression gave a accuracy of 91%. Also, analysis were performed using the criticality based on age and criticality based on different regions, which proved that logistic regression was able to come out with 95% accuracy about the recovery rate. But most of the problems faced using COVID India 19 dataset were the issues in data staging area and inadequate of required parameters. If these parameters are in place, in future, a regression analysis can be used to find out the correlation between the persons tested positive for COVID-19 with relevance to age or the medical history. It would be able to find out the clusters of affected patients so that the ICU and ventilator facilities can be focused on those clusters. It would be associations can be predicted between age and travel history and between age and the contact people. And although all these are feasible, most of them are descriptive analysis with past. Most of the papers or the work done so far seen is not peer reviewed. The drug release is only in its nasal state. So it would take months before production and is in place. Deep learning with the expertise of virologists is mandatory in this area. But what is required for India right now and how ML is going to help us is the prime cause of concern. First and foremost is monitoring of social distancing. In a place like India, where the density of population is very high, how this can be monitored, how ML can be used for monitoring is the first thing we need to ponder about. Not only that, can any algorithm can be used in predicting the requirement of ICU beds and ventilators because that is the need of hour. And disinfecting places. Can any drone or UVD based drone or AI based robots be used in disinfecting places? That is the next point which has to be looked out. So as according to me, these are the three major concerns which has to be given prime concern as of now for a country like India. So far as my references are concerned, the first and foremost, which gives an entire picture about the happenings in ML, is the first link. Machine learning methods to aid in coronavirus response, which I've taken it from towards datascience.com, and the usage of AI in fighting coronavirus is from analyticsindiamag.com. Any data pertaining to COVID, we can obtain the worldwide data from Worldometer, and from the for Indian based data, we can obtain from the Indian dashboard covid19india.org. So before I wind up, I would like to acknowledge the Wiley team, especially Mr. Deepak and Mr. Manish, who are instrumental for this webinar. The awareness of COVID-19 by all the news channels last 24/7 last couple of days. My students team comprising of Ms. Jayashree, Dwen, Manmohan, Kevin, and Vineet for data cleansing and implementing COVID-19 case using logistic regression. My friend and co-author of the book Machine Learning, Miss Vincy Joseph. So far, so good. So I would now like to introduce myself through the book Machine Learning, written by me, Anuradha Srinivasaraghavan, and my friend and colleague, Ms. Vincy Joseph. This book was aimed at the naive users to have a first glimpse of machine learning based algorithms. The math covered as well as the examples solved are simple and understandable by the beginners. Also, the Python code for most of the basic algorithms are also given in the appendix section of this book. Hope those who own a copy of this book are benefited from the same. Thank you.